What's up, guys? It's your average med student. This is part 2 of our OBGYN study with me, our ANKI with me session. I hope you like the new intro, and let's get right to it. What are the risk factors for ovarian cancer? Nulliparity, family history, early menarche, late menopause, white race, increased age, North American or European residence. What test has the highest detection rate for trisomy 21? Cell-free DNA screen. What happens to the incidence of transplacental hemorrhage as pregnancy advances? It increases. What is the most common symptom with leiomyomas and why? Menorrhagia, heavy flow, and this is because greater surface area of the endometrium and causes obstructive effect leads to vascular congestion. How is severe SLE treated? Corticosteroids. Should mild menopause be treated with HRT? How should it be managed? No, you manage it expectantly. Primary amenorrhea with cyclic abdominal pain. What's the most likely cause? Genital outflow tract obstruction, usually imperforate hymen or Müllerian agenesis. What is the carrier frequency in non-Hispanic white population for cystic fibrosis? 1 out of 25. Does advanced paternal or maternal age increase the risk of SAB? Yes. What is the treatment of symptomatic MVP in pregnancy? Beta blockers. Besides preventing RDS, what other fetal complications are decreased with betamethasone use between 24 to 34 weeks? Intracerebral hemorrhage and necrotizing enterocolitis. What does endometriosis look like on histology? Endometrial glands, stroma, and hemosiderin-laden macrophages. What chemicals released by exercise can help alleviate PMS/PMDD symptoms? Endorphins. How does breastfeeding cause decreased uterine blood loss in the postpartum period? Increased uterine contraction due to increased oxytocin release. What causes early decelerations? Fetal head compression. What are some type of infections that most commonly cause endometriitis, and how do you treat it? It's polymicrobial in origin. You can give ampicillin and gentamicin. What is seen in the endometrium histologically during pregnancy? Decidual effect. What are the risk factors for retained placenta? Prior C-section, uterine leiomyomas, prior uterine curettage, succinturate lobe of the placenta. What is a normal FHR, and what are some good accelerations? Fetal heart racing should normally be around 110 to 160 and more than 15 beats per minute lasting 15 seconds. Perimenopausal with metromenorrhagia and iron deficiency anemia, irregularly shaped and large uterus. What's the diagnosis? Uterine fibroids. What GA is vacuum aspiration recommended by? 8 weeks gestation. What is the strongest predictor of post-sterilization regret? Young age. What should be suspected in long-term fetal tachycardia? Anything over 160. Maternal fever or chorioamnionitis. Mifepristone. What's the mechanism of action, and at what gestational age should it be used? Progesterone receptor blocker, and should be used within 49 days of the last menstrual period. What are the risk factors of endometrial cancer? Nulliparity, obesity, late menopause, hypertension, exposure to unopposed estrogens. What should a congenital parvovirus infection show on ultrasound? Hydrops in the fetus. Bleeding, abdominal pain, and possible adnexal mass and closed cervix. Ectopic pregnancy. What is the most concerning histological finding for cervical cancer? What does it represent? Disorderly atypical vessels, and it represents angiogenesis. What imaging test can look for fetal anemia? MCA peak flow. How are submucosal fibroids treated in patients who are childbearing and who are also finished childbearing? Hysteroscopic myomectomy, endometrial ablation. What is the most common bacteria for postpartum mastitis, and what is it treated with? Staph aureus, you treat it with dicloxacillin. What is the average age of menopause? 51 years old. How should VIN3 be treated? Wide local excision. What should be done in a depressed infant with meconium-stained amniotic fluid? Tracheal intubation and suctioning from beneath the glottis. Does history of preeclampsia increase the risk of SAB in the next pregnancy? No. What are patients with history of depression at risk for after giving birth? Postpartum depression. What should be done 2 times per week in patient past 41 weeks gestational age? What if they are abnormal? NST and AFI, and if they're abnormal, you induce the labor. What are the most common causative agents in bacterial endometriitis? Staph and strep. What is the risk of isoimmunization in delivery? Less than 20%. What is the most common side effect of GnRH agonist therapy for fibroids? What happens after they are stopped? Hot flashes and return of menses 4 to 10 weeks, return of myoma and uterus to pre-treatment size. Treatment of bacterial vaginosis. Metronidazole by mouth, 500 milligrams BID. Woman presents with H-cell lesion on pap. What's the next best step in management? Immediate colposcopy or LEEP. What is the karyotype in Müllerian agenesis, and what are the testosterone levels going to be? 46XX, and testosterone should be normal, female range, okay? What should be visible in the uterus after a missed abortion? Some visible fetal tissue or a fetal pole. What are some risk factors that increase the chance of preeclampsia? History of preeclampsia, chronic hypertension.
Should terbutaline be used to stop preterm labor? No. What event is necessary for the pathogenesis of cervical cancer? Sexual transmission of HPV. What is the most common cause of fetal mortality with PROM before 20 weeks and why? Pulmonary hypoplasia, and this is because lack of amniotic fluid interferes with the normal intrauterine breathing process. Why are pregnant patients predisposed to pulmonary edema? They have decreased plasma osmolality. Why do fetus of moms with poorly controlled DM have polyhydramnios? High glucose causes polyuria. What condition raises the chance for a newborn with caudal regression syndrome? Poorly controlled DM. What clinical finding is commonly seen in patients with endometriitis? Uterine fundal fullness. What do postmenopausal ovaries produce, and what can occur when they are removed? Androgens, and if you remove them, you get resurgence of menopausal symptoms. What is the imaging test of choice for suspected appendicitis in pregnancy? Graded compression ultrasound. 36-week pregnant with placental previa undergoes vaginal bleed 3 times, and what's the next best step in management? C-section. What is the worst complication associated with multiple gestation? Preterm birth. What may uterine fibroids in lower uterine segment cause? C-section delivery. What should be started in fracture patients with a high risk of osteoporosis? Bisphosphonates. What is the mechanism of action for danazol? It suppresses the mid-cycle surges in FSH and LH. Patient with non-viable IUP does not want intervention. What's the next best step in management? What should be given if the patient is Rh negative? Expectant management, and you give them RhoGAM. Anyways. What should be done in women with advanced ovarian cancer in addition to surgery? Adjunct chemotherapy. Why may appendicitis present in the right upper quadrant in pregnancy? Enlarging uterus elevates the appendix. Patient with thinning of skin, oily skin, acne, deepening of voice, clitoral enlargement, menstrual irregularities. What's the most likely diagnosis? Steroid cell tumor. In a woman who is poor surgical candidate, what should be considered for sterilization surgery? Vasectomy for the husband. What is mucopurulent cervicitis a sign of, and how is it treated? Gonorrhea or chlamydia, and you treat it with ceftriaxone and azithromycin just to treat for both. How do fibroids appear on histology? Well-circumscribed, non-encapsulated myometrium. What can cause dyspareunia and early cessation of menstruation? Premature ovarian failure. What is the biggest predictor of patch failing as contraception? A woman's weight. What is the most common side effect of the depot shot? When does it usually resolve, and what % of users have amenorrhea at the first year? Irregular bleeding, 2 to 3 months, and 50% of users will have amenorrhea at the first year. What should be used to treat syphilis in pregnancy? What if patients have anaphylactic reaction to penicillin? Intramuscular penicillin G, and you have to desensitize and treat them with penicillin anyways if they're still allergic. Treatment of squamous cell carcinoma of the vulva. Radical vulvectomy. What are the symptoms that precede an outbreak in primary HSV infection? What can cause reactivation of HSV? Systemic symptoms: fever, headache, malaise, myalgias, immunosuppression. Severe dysmenorrhea that does not respond to NSAIDs, OCPs, and depot. Most likely diagnosis and next step: endometriosis and laparoscopy. Vaginal lesion showing budding yeasts and pseudohyphae. What's the most likely diagnosis? Yeast vaginitis. Vaginal pruritus with vaxi, paper thin skin. Likely diagnosis and treatment. What are patients at risk for? Lichen sclerosis, topical corticosteroids, and they are at risk for squamous cell carcinoma. What are the risk factors for PROM? This is premature rupture of the membrane. Genitourinary infection, smoking, history of PROM, and shortened cervical length. What pregnancy complications are increased by smoking? Placental abruption, placental previa, fetal growth restriction, preeclampsia, and infection. How much calcium should a postmenopausal woman take daily? 1,200 milligrams. What is the treatment for infertility in PICO syndrome? Metformin and ovulation induction. What should be used to treat thyroid storm in a pregnant patient? Thioamides like PTU, propranolol, sodium iodide, and dexamethasone. What should be done if fetal heart rate cannot be assessed during using external methods? You apply fetal scalp electrode to monitor fetal well-being. Yellow frothy vaginal discharge. What's the most likely diagnosis? Trichomoniasis. What do 40 to 50% of women with chronic pelvic pain have a history of? Physical or sexual abuse. What is the only way to confirm the diagnosis of endometriosis? Exploratory surgery and biopsies. What is an appropriate IV antibiotic regimen for PID? IV cefotetan, and IV doxycycline. What can be done in a stable patient with an abnormal IUP due to presence of a yolk sac? Expectant management. What is the medical treatment of postpartum depression if patient has suicidal ideation? SSRI and inpatient hospitalization if they have suicidal ideation. What are Lewis antibodies, and do they cross the placenta? They're IgM, and they do not cross the placenta. Should informed consent ever be signed after a procedure is completed? No. What can cause tachycardia in molar pregnancy? Hyperthyroidism. New onset hard, non-tender lesion in area of Bartholin's gland. What's the most likely diagnosis? Primary vulvar ADENOcarcinoma. Abdominal pain, bleeding, uterine hypertonus, and fetal distress. What's the most likely diagnosis? Placental abruption. What is the normal age for menarche? 9 to 17 years old. What should an ultrasound be used to date a pregnancy between 16 to 22 weeks? When there is over a 10-day discrepancy between it and LMP. Patient status post medical abortion, having heavy bleeding. What's the most likely cause and next step in management? Retain products of consumption, and you have to do a DNC to clear it out. When does PMDD occur? Last week of the luteal phase and beginning of the follicular phase. Ask us HPV negative. What's the best next step? Repeat the pap smear with HPV testing in 3 years. What should be done in a patient who desires fertility but has fibroid obstruction, distortion of the uterine cavity? Myomectomy. When is a DEXA scan recommended? In high-risk patients prior to age 65. When should RhoGAM be given to Rh-negative mothers? At 28 weeks and whenever fetal blood may have entered maternal circulation, such as delivery, when the amniotic sac ruptures, CVS, and SAB. What type of bladder prolapse is hysterectomy associated with? Apical. Incidental adnexal mass is found. What's next best step? Pelvic ultrasound. What is the diagnostic for Down syndrome and other chromosomal abnormalities? Amniocentesis. What is chorioamnionitis and indication for? Delivery. What is the major cause of increased C-sections? Decreased VBAC. What is the most common cause of fetal demise in a patient without prenatal care? Uncontrolled glucose, diabetes mellitus. Can magnesium sulfate be used on myasthenia gravis patients? No. What morbidities are obese women at risk for in pregnancy? Chronic hypertension, GDM, preeclampsia, fetal macrosomia, increased CS, and postpartum complications. When should women receive intrapartum antibiotic prophylaxis for GBS without even obtaining a culture? Previous birth with neonatal GBS sepsis, GBS bacteriuria in current pregnancy. Which nerves are commonly entrapped following pelvic surgery? Iliohypogastric, ilioinguinal nerve. Hirsutism with normal lab values, normal BMI, and regular menstruation. What's the most likely diagnosis? Idiopathic hirsutism. What are associated post-term pregnancies? Placental sulfatase deficiency, fetal adrenal hypoplasia, anencephaly, inaccurate dating, and extrauterine pregnancies. What is the most likely cause of painless cervical dilation leading to bulging membranes? What procedure places that patient at increased risk for this? Cervical incompetency and cone biopsy will place them at a high risk. Large fundal height for age with increased AFP. What's the most likely diagnosis? Twin pregnancy. What is a category A drug? Well-controlled trials show no risk in pregnancy. What should be done with all solid breast lesions? Cytological evaluation, either fine needle aspiration or excisional biopsy. Most common cause of UTI in young sexually active women. What organisms cause increased infection in this population? E. coli, Staph saprophyticus. What should be done in a vigorous infant with meconium-stained amniotic fluid? Nothing. Where is the best place to show info for domestic violation outreach and why? The office restroom, private place where spouse cannot prevent patient from obtaining it. What should be done to ensure maintenance of pregnancy in a patient with recurrent SABs due to cervical insufficiency and when? Cervical cerclage, 14 weeks gestational age. What should be supplemented in all women of reproductive age, especially if they are planning to become pregnant? Folate. LSIL with CIN1, what's the next best step in management? Follow up with pap smear in 1 year. When does postpartum depression occur? What if symptoms occur and go within 2 weeks of birth? 2 weeks to 6 months after delivery, it is called postpartum blues. What are risk factors for ectopic pregnancy? Prior ectopic, increased age, history of abdominal surgery, history of STIs, history of CNS, uterine malformations. What should be done if a patient requests abortion without insurance? Appropriate counseling and support for abortion. Short contractions that are less intense than true labor and cause discomfort in the lower abdominal and groin areas. What's the most likely diagnosis? Braxton Hicks contractions. What is the best way to present premature, low birth weight babies in twin gestation? Good early weight gain. What is the most common karyotype encountered in spontaneous abortions? Autosomal trisomy. If a patient is still competent, can their power of attorney make decisions for them? No. Patient with a PPH and firm uterus, what should be looked for? Retained placental tissue and lacerations. What is the goal for fasting blood glucose in GDM and 2-hour postprandial? Fasting should be under 90 and 2 hours postprandial should be under 120. What are the babies of mothers with poorly controlled diabetes mellitus prior to conception and during organogenesis at increased risk for? Structural abnormalities such as neural tube or cardiovascular. What should be used to treat mild PMDD? OCPs, and this suppresses the HP axis. What should be ruled out in recurrent SAB 3 first trimester losses? Systemic disease, SLE, diabetes mellitus, thyroid disease, and maternal or paternal karyotype analysis, and uterine anomalies, and infectious causes. How should HIV positive mothers breastfeed? Or should they? No. What can breast engorgement cause? And what's the treatment? It can cause low-grade fever and frequent breastfeeding or pumping is the treatment. What are testosterone levels in PCOS and LH levels? High and high. What is the role of tocolysis in PPROM? Delay delivery so steroids can be given to induce lung maturity. Twin-twin transfusion syndrome. What is the recipient twin at risk for, and what is the donor twin at risk for? Volume overload and polycythemia, intrauterine growth retardation, and oligohydramnios. What is the best test to evaluate for endometrial polyps and fibroids? Pelvic ultrasound. Do twins have a higher incidence of congenital anomalies? Do both twins usually have the anomaly? Yes, but both they may not. Usually it's discordant. What are the common causes of acute pulmonary edema in pregnancy? Tocolytic use, cardiac disease, fluid overload, and preeclampsia. What should be done if a patient has beta HCG under 1500 to 2000 and no visible IUP on ultrasound? Repeat the beta HCG in 48 hours. What disorder mimics PMS but occurs throughout the entire cycles? Hypothyroidism. Adnexal mass in setting of endometrial hyperplasia. What is the mass and what is it producing? Granulosa cell tumor, it is producing estrogen. What does umbilical cord prolapse cause, and what % of births does it occur? Sustained fetal bradycardia, about 0.2% to 0.6%. What is very important for pregnancy dating in a patient with irregular menses? Ultrasound, preferably first trimester. What should be done in all patients over 40 years old with leiomyomata? Endometrial biopsy. What 3 factors are needed for the onset of menses? Adequate body weight, 85 to 106 pounds, sleep, and optic sunlight exposure. What uterotonic should not be used to control PPH in asthmatics, and why? Hemabate, prostaglandin F2 alpha, has bronchoconstrictive effects. Fetus with late decels and oligohydramnios, what's the next best step in management? C-section. How many placenta are seen in dizygotic pregnancy, and how many in monozygotic? You see 2 in dizygotic, and sometimes you can see 1 or 2, or if they're split before 4 days in monozygotic. What fetal problems are associated with post-term pregnancy? Macrosomia, oligohydramnios, meconium aspiration, uteroplacental insufficiency, and dysmaturity. How can atrophic vaginitis lead to sexual dysfunction? How can it be treated in a woman with history of breast cancer? Dyspareunia, water-based lubrication, estrogen is contraindicated. What can be done in premenopausal women to reduce risk of ovarian cancer? Use of OCPs until they are ready to have children. What is a Bakri balloon? When is it used? A balloon that is placed in uterus and filled to place pressure inside the uterus, PPH due to uterine atony. Can a patient on SSRI breastfeed? Yes. What should be given to women with unknown GBS who go into preterm labor? Ampicillin. What vaccines are contraindicated in pregnancy? Live vaccines, MMR and varicella. When do symptoms of premenstrual dysphoric disorder occur? When do they not? At the luteal phase, and it's absent in the follicular phase. What is necessary to establish a diagnosis of chorioamnionitis, and is a biopsy needed? Positive beta HCG in a woman with history of recent pregnancies, and biopsies are not needed. What size babies are more common in type 1 diabetic mothers? What is the blood sugar most likely to be after birth? Small babies and low. When do women with a positive GBS culture not need interpartum antibiotics prophylaxis? If C-section is performed. What happens to the ureters and renal pelvis in most pregnant women? Which side does it occur more on, and why? Dilation occurs on the right side because the dextrotation of the uterus causes greater compression of the right ureter. What % of patients develop endometritis after vaginal delivery and after a C-section? 2% after vaginal delivery and 10 to 15% after C-section. What is the only definitive treatment of preeclampsia? What should be given during labor and for 24 hours after delivery? Delivery, Magsulf, which will cause decreased seizures. How long should patients wait after molar pregnancy to get pregnant again? 6 months after negative beta HCG. What urine protein is needed to diagnose preeclampsia, severe preeclampsia, and what blood pressure? 3 grams for preeclampsia, and for severe preeclampsia it's 5 grams, and blood pressure for preeclampsia is 140/90 and severe is 160/110. What hormone causes fibroids to grow? What medication can be given to keep them from growing? Estrogen, and then gonadotropin releasing hormone agonists can keep them from growing. What is the most common karyotype in SAB, and which chromosome? Autosomal trisomy 16 and chromosome 16, I guess. What are the non-pathological causes of increased MAFP in pregnancy? Underestimation of gestational age and multiple gestation. How do GnRH agonists control chronic endometriosis? They downregulate the HB axis. What is tachysystole on tachometer and a sign of, and what should be suspected when it presents in the 3rd trimester with vaginal bleeding? Fetal anemia, and you can suspect placental abruption. What are the risks secondary to dilation and curettage? Bowel and bladder injury, cervical lax, and uterine perforations. What endocrine side effect can imipramine cause? Hyperprolactinemia. At what gestational age is the risk of microcephaly and severe ID the greatest? What should be avoided at this time if possible? 8 to 15 weeks, and you should avoid radiation, such as x-rays. What should be done in a molar pregnancy to look for metastases, and why? Chest x-ray and lungs are the most common sites of metastases. What is the least invasive for sterilization surgery? What must be done for 3 months after? Hysteroscopic tubal occlusion, coils in fallopian tubes, and backup contraception for 3 months after. What can increase the fetus's chance of having umbilical cord compression? Oligohydramnios. What is the first-line treatment of endometriosis and mechanism of action? OCPs. Negative feedback causes decreased estrogen, and causing decreased endometrial proliferation. When does the labor progress from the latent phase to the active phase? When the cervical dilation is over 4 centimeters. Induction of labor. What should be done to Pitocin if cervix is unfavorable? Give cytotec. Vulvar lesion, unresponsive to treatment. What's the next best step? Biopsy. What factor has the greatest predictive value for survival in ovarian cancer? Tumor stage. Vaginal bleeding, positive pregnancy test, closed cervical os. What's the most likely diagnosis? Threatened abortion. What is the safest way to prevent lactation in a postpartum woman? Breast binding, ice packs, and analgesics. What is severe SLE in pregnancy best treated with? Corticosteroids. What type of mastitis occurs in weeks 2 to 4 after delivery, and how do you treat it? And do you stop breastfeeding? Puerperal mastitis and acetaminophen with NSAIDs for pain relief, and you do not stop breastfeeding. What is respiratory depression? What is respiratory depression in patients on MagSelf, a sign-off? What should be done? Magnesium toxicity, and stop the magnesium, start calcium gluconate. What can be used to treat atrophic vaginitis in postmenopausal women? Topical estrogen cream. Intake of what can increase pain from fibrocystic breast changes? Caffeine. What is the initial management of newly diagnosed GDM? Benign diabetic diet and glucose monitoring. What does oxytocin not work at an early gestational? Why does oxytocin not work at an early gestational age? There has not been upregulation of beta receptors. How do vascular diseases cause intrauterine growth retardation? Uteroplacental insufficiency. Alright guys, thank you so much for listening, and if you made it this far, great job. We did about 200 cards today, and this about wraps up part 2 of our OBGYN high-yield ANKI flashcards. I just want to let you know I did not make these flashcards. I'm just, I downloaded the UWise ANKI deck, and I'm just going through that for OBGYN. So I know there's a lot of spelling errors and whatnot, and I'm trying my best to read through them, so please bear with me, and I apologize for any confusions. So that's why if you have any questions or comments or concerns, or any critiques that, you know, if there's something I can do to improve the content, please let me know in the comments below. And yeah, we'll see you in the next video. Take care.